Welcome to Family Dentistry of Frisco, Laser, Sedation and Implant Center, where your smile is our passion. My name is Dr. Paresh B. Patel, and I wanted to take this opportunity to tell you a little bit about what is a dental implant. At our comprehensive dental office, we offer laser, sedation and implant dentistry. Dental implants have come a long way in the past 20 to 30 years and represent a consistent, predictable and viable option for patients to replace missing teeth. Our facility is located in the heart of Frisco, Texas, and you can visit our website at www.fdfrisco.com. In the case that we'll talk about today, I'm going to talk about the components of a dental implant and how a dental implant is placed. Here you can see some of the indications for a dental implant. Teeth can be lost for many reasons due to trauma, decay, infections, and periodontal disease, to mention just a few. If you suffer from loss of teeth, you should come and get an opinion. We have the ideal facility to help resolve these missing teeth and to help you get back the smile you deserve. In the following slide, you can see the components of a dental implant alongside a natural tooth. Dental implants essentially are composed of three components: the implant itself, which is placed within the bone; the abutment, which represents the connective component that connects the implant to the crown; and then the crown, which is the part that we see within the mouth and that we bite to chew with and that we smile to show. This can be placed in the mouth in different ways. Here the case presentation, we have a 59-year-old female who will be losing a tooth, or rather lost a tooth, due to a cracked tooth. The tooth had been previously root canal filled approximately 10 to 12 years ago, and she had come in with pain from that tooth. When we examined the tooth, we found that it did have signs of being cracked, and there was pain on biting. The next slide shows you the tooth in question. It's tooth number 30, or the lower right first molar. And that tooth had previously been root canal filled, as I mentioned, and had a porcelain fused to metal crown in situ. The patient was very concerned with this pain and had sought an opinion with regard to what she could do with the tooth. We felt that root canal treatment was not really a viable option because the tooth showed signs of being cracked. Here you can see an x-ray or a radiograph of the tooth that shows the tooth with a crown on it and the previous root canal that had been carried out about 10 to 12 years ago. We told her about the options and that we could potentially remove the tooth and place the dental implant at the same time, thereby negating the need for a second surgery to place the implant. At Family Dentistry of Frisco, Laser, Sedation and Implant Center, we have an in-house CT scanner which allows us to three-dimensionally measure and see the bone quality and quantity, and also to map nerves within the bone cavities to minimize the potential of nerve damage or nerve trauma. After completing the CT scan, we went ahead and planned to place a dental implant in the site where we're going to do the extraction. In this picture you can see the dental implant in place with what I like to call a button stud. It appears to be like a little button stud, but it's a healing cap, and what that allows us to do is to form the tissues that connect the outside, or rather the inside of your mouth, to the dental implant. The healing process is usually between 10 to 13 weeks for full integration. In this case, integration was complete in about 12 weeks, and here you see a picture of the dental implant when we took the healing cap off at review at 3 months. You can see very good tissues, look very clean, and that blue component that you see in the patient's gum is the dental implant. This is a stage at which we would take the impression that would allow us to place the dental implant crown on the patient's tooth. Here is an x-ray or a radiograph of the implant fully integrated, and what I mean by that is that the patient's bone has stuck, or rather fused, to the implant, and now that implant is wholly a part of the patient's jawbone. And this is the remarkable nature of dental implants, which has allowed them to be a viable and predictable option for replacement of missing teeth. Once we take the impression, we send this impression to the laboratory and we can get a crown made. And here you see the dental implant crown. It's a screw retained crown, and what I mean by that is there is no glue or cement needed to place this crown in the patient's mouth. We adjust the crown, we place it onto the dental implant, we torque it down, and then the little hole that you see in the biting surface of the crown is covered with a white filling material. I personally like this type of restoration because it allows us a very easy way of retrieving the crown, and also minimizes the effects of potential cement and things of that nature. And here you see the dental implant crown in place in the patient's mouth, and might I say, it looks rather nice. Again, at Family Dentistry of Frisco Laser Sedation and Implant Center, we have a wide number of options available to our patients to place dental implants. Please do visit our website at www.fdfrisco.com. Come and make this your dental home, and let us see if we can help you to achieve the smile that you deserve and that you should show every day. Thank you very much, and I hope you appreciate this video log.